Bismillahirrahmanirrahim. Quote for today is: the greatest glory in living lies not in never falling, but in rising every time we fall. And this is by Nelson Mandela. Today, the topic of my presentation is open vial policy, monitoring heat and freeze damage to vaccines, under the supervision of my professor, Dr. Saira Afzal. Learning outlines of the presentation are introduction to open vial policy, WHO multi-dose vial policy, WHO pre-qualified vaccines, monitoring heat exposure and vaccine vial monitor, freeze damage and shake test, recent updates and MCQs at the end. Learning outcomes are at the end of this presentation. Participants will be able to describe what is open vial policy, WHO multi-dose vial policy, WHO pre-qualified vaccines, monitoring heat exposure, and vaccine vial monitor, freeze damage, and how to perform shake test. Now, what is open vial policy? Implementation of open vial policy allows reuse of partially used multi-dose vials of applicable vaccines in subsequent sessions, both fixed and outreach, up to 4 weeks, like 28 days, subject to meeting certain conditions, and thus reduce vaccine wastage. Now, what is a multi-dose vial? A multi-dose vial is a vial of liquid medication intended for parenteral administration that contains more than one dose of medication. Multi-dose vials are labeled as such by the manufacturer and typically contains an antimicrobial preservative to help prevent the growth of bacteria. The preservative has no effect on viruses and does not protect against contamination when healthcare personnel fail to follow safe injection practices. Background for this is as vaccines increase in price, wastage is growing concern for many immunization programs. It is therefore important to ensure that countries have information on which multi-dose vials of vaccines can be kept open for extended periods of time to minimize vaccine wastage while at the same time ensuring vaccine safety. The policy statement on the use of multi-dose vials issued in 2000, which this document replaces, has allowed immunization program managers to reduce wastage of vaccine doses in open vials while ensuring that the vaccines are safe for use. However, today's vaccines are different from previous vaccine products, making application of the original multi-dose vial policy more challenging. The original policy separated vaccines by type and specified that liquid vaccines could be kept open for reuse for up to 28 days, while lyophilized vaccines were to be discarded by the end of immunization session or 6 hours after opening, whichever came first. Since 2000, many new vaccines have been developed, many of which have already been included in EPA schedule. In 2014, there are more than 30 types of vaccines that are pre-qualified by WHO, comprising over 120 different products. Due to complexities of these vaccines formulations, not all vaccines in use today fit into simple liquid that is keep for 28 days or lyophilized that is discard within 6 hours, categorized as previously recommended. Such vaccines include liquid vaccines in presentations of greater than one dose that do not contain preservatives, or those that contain preservatives which do not meet the required standard of preservative efficacy. Vaccines with preservatives that do not meet these minimum standards may not be able to be kept safely for up to 28 days without risking bacterial growth. Open vials must therefore be discarded at the end of an immunization session or within 6 hours after opening, whichever comes first. It is therefore necessary to revise the multi-dose vial policy, and the present policy brief outlines these changes. Now, what is WHO multi-dose vial policy? That was in 2014. It shows that all opened WHO pre-qualified multi-dose vials of vaccines should be discarded at the end of immunization session or within first 6 hours of opening, unless the vaccine meets all the 4 criteria. If the vaccine meets the 4 criteria, the opened vial can be kept and used for 28 days after opening. A summary of 4 criteria is: the vaccine is currently pre-qualified by WHO. The vaccine is approved for use for up to 28 days after opening the vial as determined by WHO. The expiry date of vaccine has not passed. And fourth is that the vaccine vial has been and will continue to be stored at WHO or manufacturer recommended temperatures. Furthermore, the vaccine vial monitor, if one is attached, is visible on the vaccine label and is not past its discarded point, and the vaccine has not been damaged by freezing. Now, the point one is the sorry, the vaccine is currently pre-qualified by WHO. In order for a vaccine to be qualified, WHO independently evaluates data on the vaccine quality, safety, and efficacy. This evaluation includes examining the effectiveness of preservatives as well as the stability of the vaccine under different temperature conditions. In addition, the pre-qualification program assesses such things as the quality of vials, stopper, caps, and labels. Taken together, these allow the safety and efficacy of the vaccines to be assured, particularly after opening. If WHO does not have adequate information to determine the behavior of vaccine after the vials have been opened, the vaccine is not pre-qualified. Now, the second point was that was used in the summary criteria is the vaccine is approved for use for up to 28 days after opening the vial as determined by WHO. For injectable vaccines, this means that the vaccine contains appropriate type and amount of preservative. Multi-dose vials of oral vaccines may not contain preservatives, but nevertheless may be kept and used for up to 28 days after opening the vial, unless otherwise indicated. Each WHO pre-qualified vaccine has a vaccine product page on the WHO website with a specific reference that shows handling of the opened multi-dose vials. This description provides information to program managers and national immunization officials on the proper handling of multi-dose vials for each available presentation. The third point in the summary shows the expiry date of the vaccine has not passed. This condition is a part of immunization best practice and is included here to emphasize the importance of not using a vaccine vial after the product has expired. The expiry date may be reached over the course of 28 days, so in line with the good practice, the expiry dates of all open vials should be checked prior to every use. Fourth point in the summary is the vaccine vial has been and will continue to be stored at WHO or manufacturer recommended temperatures. All vaccines, with the exception of those approved for use in a controlled temperature chain, should be stored according to WHO or manufacturer recommended temperatures, normally between plus 2 degrees centigrade to plus 8 degrees centigrade, and should be protected from freezing and sunlight where relevant. Prior to use, the vaccine vial monitor should be consulted to ensure that it has not breached the discard point. If it has, the efficacy of the vaccine has been compromised by the excessive heat exposure, and vaccine should be discarded. If the vaccine vial is labeled as freeze sensitive and is suspected of having being frozen, or temperature alarm indicates exposure to sub-zero temperatures, the shake test should be performed to assess if there has been damage to the product, and the vaccine should be handled accordingly. Application to special strategies. This section describes provisions for handling of multi-dose vials when these are open. Campaign and outreach situation. Provided that the vaccine meet the four criteria defined above for keeping opened multi-vials for up to 28 days, and as long as appropriate handling procedures are followed to diminish the risk of vial contamination, open vials can be used in subsequent immunization session in different sites for up to 28 days. However, in order to implement the multi-dose vial policy safely, open vaccine vials must continue to be kept at the recommended temperature after opening. In particular, it is important to keep open multi-dose vaccine vials that do not contain preservatives, whether lyophilized or liquid, cooled at temperature between plus 2 and plus 8 degrees centigrade during the immunization session or within 6 hours after opening, whichever comes first. Keeping these open vials cool will reduce the risk associated with growth from microorganisms that may have been introduced into the vials. Use in a controlled temperature chain. WHO has recently defined a controlled temperature chain whereby specific vaccines are pre-qualified for use at temperature of up to 40 degrees centigrade for limited periods of time. For vaccines approved for use in a controlled temperature chain, a specific guidance on how to maintain the correct temperature range and adhere to other predefined controlled temperature chain conditions is available from WHO. Applications of the multi-dose vial policy in controlled temperature change settings may vary by vaccines. In these cases, consult the product insert and WHO website on how to apply this vial policy for each controlled temperature change vaccine. Scientific rationale for the policy. There are both economic and operational advantages in applying the policy, but there are also risks if the policy is not applied correctly. First is assuring safety and efficacy. It can be affected by improper vaccine handling. WHO reviews the preservative efficacy of the vaccine and contains insufficient level of preservative, traditionally that is thimerosal. WHO recommends discarding all non-WHO pre-qualified vaccine products within 6 hours after opening or at the end of immunization session that comes ever first. Time limits for keeping open multi-dose vial policy. All multi-dose vials should be discarded at the end of immunization session or after 6 hours of opening. If it does not contain an effective preservative and preservative efficacy have not been vigorously reviewed. New vaccines and presentations, including fractional doses. The multi-dose vial policy describes here and applied to all multi-dose vials of vaccines for all WHO pre-qualified vaccines and all new vaccines that become WHO pre-qualified. Single dose presentation but can be used as a multi-dose presentation if delivered as a fractional dose, for example, rabies vaccine or influenza vaccine. As these single dose vaccine vials do not contain preservatives, discard them after 6 hours. Vaccine preservatives are recommended to use thimerosal as preservative. However, global ban on mercury and mercury-related products after 2012 was being given. Now, how to implement the policy safely? First is use of visual triggers. This shows the WHO pre-qualified vaccine where vaccine while monitoring if attached is on the label of vaccine. The vaccine while once opened can be kept for subsequent immunization sessions for up to 28 days regardless of the formulation of product or lyophilized. WHO pre-qualified vaccine where the vaccine while monitoring is attached in a different location than on the label. For example, cap or neck of the ampule. In this instance, the vaccine, while once opened, must be discarded at the end of immunization session. This is regardless of the formulation of the product and would apply, for example, to a reconstituted product of which the vaccine vial cap, which has a vaccine vial monitoring attached and has been discarded after opening. Check WHO pre-qualification website. The range of the vaccine pre-qualified by WHO regularly expands and changes. As a result, WHO routinely updates the individual vaccine product sheets available on the WHO pre-qualification website. To ensure that a specific vaccine is approved for use for up to 28 days after opening the vial. These individual vaccine product sheets on the website should be consulted, referencing the description handling of opened multi-dose vials. Good immunization practice, appropriate storage and transport conditions, appropriately preserved, appropriate use conditions, and training. Expanded program on immunization, that is multi-dose open vial policy, or pre-qualified vaccines that can be stored up to 6 hours and vaccines that can be stored after opening the vial for 28 days. BCG, measles, and PCV can be stored for 6 hours. However, DPT, tetanus toxoid, Hep B, OPV, liquid pentavalent, and IPV can be stored up to 28 days after opening the vial. Now, National EPA Policy and Strategic Guidelines for Pakistan in 2015. This shows that the use of multi-dose vials Vaccine vials opened in subsequent immunization session. A partially used multi-dose vaccine vial with preservative can be used in the next immunization session only if all of the following conditions are met. The vaccine is pre-qualified by WHO. The vaccine is approved for use up to 28 days after opening the vial as determined by WHO. The expiry date has not passed and the vaccine has not been contaminated, and the vials have been stored at WHO or manufacturer recommended temperature, and the vaccine vial monitoring on the vial if attached has not reached. To avoid any adverse event, multi-dose vaccine vial without preservatives such as PCV10 must be discarded no later than 6 hours after opening or at the end of session. Vaccines Logistic Manual that shows expanded program on immunization. Policy on use of open vials of vaccine. In EPA Pakistan, vials with more than one dose are used, for example, for BCG, OPV, PCV10, measles, and TT. WHO recommended global policy on the use of open vials of vaccines is as follows. First is open vials of OPV and tetanus toxoid may be used in subsequent immunization sessions until a new shipment of vaccine arrives, provided that each of the following conditions are met. Second point is open vials of PCV10, measles, and BCG vaccine must be discarded within 6 hours. Third is an open vial must be discarded immediately if any of the following conditions apply. That are, if sterile procedure have not been fully observed, if there is even a suspicion that open vial have been contaminated, or if there is visible evidence of contamination, such as a change in appearance or floating particles, etc. Fourth is store the partially used OPV and tetanus toxoid vials in separate box inside the refrigerator, keeping them upright. Actions that should be taken are use before expiration date, write on the vials, share and transport between 2 and 8 degrees centigrade, maintain good hygiene and vaccine handling practices, read the instruction and recommendation of the provider and national guidelines. However, the cautions that also there do not use if vial stopper has been submerged in water from leaking cold packs. Do not leave needles in the vaccine vial stopper. Do not pre-fill syringes with the vaccine. After the immunization session, at the end of immunization session, all open vials should be returned to cold chain center. At the cold chain point, open vial policy should be segregated into reusable pentavalent tetanus toxoid Hep B vials, fulfilling the above mentioned criteria, and non-reusable vials of measles and BCG. All open vials of measles and BCG should be destroyed after 6 hours of opening. In case of any problem, all open vials, whether reusable or not, should not be destroyed. All open vials should be recorded in a stock register. Well-sealed ice packs should be used in vaccine carriers so that the leaked water does not cause any contamination. Now monitoring heat exposure using vaccine vial monitors. Now, what is a vaccine vial monitor? The vaccine vial monitor is a type of monitor device applied directly to each vaccine vial by the manufacturer. It enables the health workers to verify at the time of use whether vaccine is reusable condition and has not lost its potency and efficacy due to temperature exposure. The vaccine vial monitor progressively changes color with heat exposure and gives a visual indication when the exposure has occurred. The vaccine itself, of course, exhibits no visual change with heat exposure. How does a vaccine vial monitor works? The vaccine vial monitor has a heat-sensitive square in a circular disc that registers a gradual and progressive color change with exposure to heat. The inner square is initially white but becomes darker with exposure to heat. All the time, the inner square is lighter than the surrounding disc. The vaccine is safe for use. If the inner square becomes of the equal color or darker than the surrounding disc, the vaccine must not be used. How to read vaccine vial monitor? The only important point is the color of inner square that is relative to outside color. If the inner square is lighter than the outside, the vaccine may be used. However, if the inner square is same color or darker, the vaccine must not be used. The table shows constant temperature day and night and time for vaccine vial monitor to reach discard points. At room temperature, it should be discarded in 8 days. At room temperature 20, it should be discarded in 20 days. At a temperature in the refrigerator at 4 degrees centigrade, it should be discarded in 128 days, or in a freezer -20. It can be kept for over 2 years. Types of vaccine vial monitors. Some vaccines are more sensitive to heat than others. For this reason, there are currently 4 different types of vaccine vial monitors that are designed to match vaccines with different heat stability. For example, vaccine vial monitor used for OPV because this is the most heat sensitive vaccine. This vaccine vial monitor reaches its discard point only after 2 days at 37 degrees centigrade. In contrast, hepatitis B vaccine is very heat stable. The vaccine vial monitor is used when it takes 30 days to reach its discard point at 37 degrees centigrade. The table also shows a time to reach endpoint, time to endpoint at 25 degrees centigrade, and time to reach at endpoint at 5 degrees centigrade. This shows vaccine vial monitoring. Stage 1 is that good and you should utilize. Stage 2 is good and utilized. However, stage 3 and stage 4, the central square is equal or darker than the surrounding circle, so it should not be used. Freeze damage to vaccine. The vaccines that are freeze sensitive will get spoiled if they get frozen. The cause of vaccine freezing are improper storage, cold climate, storage transport, incorrect thermostat adjustment, and untrained or improperly trained staff. Freeze watch indicator is an irreversible temperature indicator which shows if vaccines has been exposed to temperature below 0 degrees centigrade. Now, what is vaccine shake test? Shake test is used for determining if the absorbed vaccine has been frozen any time in the past. The test is valid for absorbed vaccines such as only DPT, DT, tetanus toxoid, pentavalent vaccine, and hepatitis B. Now, steps of shake test are given, and these are also shown in the figure. First figure is controlled vial, deliberately frozen and thawed. Both the vials are vigorously shaken and kept side by side at the starting point. Second figure shows deliberately frozen and thawed, and first test vial settled at the same rate as the controlled vial and then discard. And second test vial is sedimentation slower than the controlled vial, and it can be used. This shows frozen test vial, frozen control vial, and non-frozen test vials. This picture shows deliberately frozen vials and suspected vials. Deliberately frozen shows thick segments and almost clear, and suspected vials are almost like they get sedimented more slowly. And if their sediments in the suspected vial settle at the same rate, the suspected vaccine may not be used. This shows that vaccines that are never frozen and immediately after shaking, they're smooth and cloudy. And if these are not smooth, you can use granular particles. And 30 minutes after shaking, if it starts to get clear and no sediments, it can be used. However, do not use the vaccine if it's almost clear and thick sediments at the end. Now, recent updates. An article recently published is maximizing number of doses drawn from multi-dose COVID-19 vaccine by minimizing dead volume. This shows that on December 20th, 1st, 2020, the highly effective Pfizer vaccine was authorized in Europe, bringing big hopes for upcoming pandemic. However, there are concerns about the delayed availability of sufficient vaccine doses, forcing to prioritize target population. Each vial meets the requirement of the European Pharmacopoeia, allowing to obtain 5 doses using the syringe of a capacity not exceeding 3 times the volume to be measured and fitted with a 21 gauge needle not less than 2.5 centimeter in length. Another article published is Fractional Dose Inactivated Poliovirus Vaccine Campaign in Sindh Province, Pakistan in 2016. This shows that areas with sewage drainage to Sida's pumping station from which the VDPV isolates were identified, and those within the potential zone of poliovirus circulation were chosen for campaign implementation. The target population for the campaign comprised about 258,000 children that were aged in 4 to 23 months. In contrast to OPV campaigns in which house-to-house visits constituted the primary strategy for vaccination activities, this campaign was conducted at the fixed site, such as hospital and dispensaries, and through deployment of the outreach team to designated vaccination stations. This was to ensure cold chain maintenance and safe injection practices. Coming towards the MCQs, first MCQ is a vaccinator from a BHU. XYZ was taking the pentavalent vaccine for use in routine EPI program. He noticed that vaccine while monitoring for batch A is getting darker, but not reach the discard point, and their expiry date is much longer than the batch B, whose vaccine while monitor is good, but their expiry date is left only a few weeks. Which batch of vaccine should he has to consume first to avoid vaccine wastage? Option A, first batch A, then batch B. Option B, first batch B, then batch A. Option C, both batches should be consumed together. And option C, discard all vials of batch A and use batch B. Option A is the right one. First batch A and then batch B should be used.
A.
Second MCQ is a vaccinator from BHUXYZ keeps hepatitis B vaccine vials in his domestic refrigerator at different ranges of the temperature of cold chain center when that is out of order. He suspects that some vials has been damaged as he noticed some ice in them. He took out of one control vial and one test vial and performed shake tests on them to check vaccine damage. How will you interpret this test? Option A, test vials can be used if its sediment settles more slowly. Test vials can be used if its sediment settles more faster. Test vials can be used if the sediments of both vials settle at the same rate. Test vials will be discarded if its sediments settle faster, and control vial can be used after the test.
C.
C.
Option A is the right one. Test vials can be used if its sediment settles more slowly. Third MCQ is a vaccinator from a BHU keep IPV vaccine vial in his domestic refrigerator at different ranks as the ILR of the cold chain center is out of order. He suspects that some IPV vials has been damaged due to extreme low temperature. He took out one control and test one vial and performed shake test on them to check vaccine damage. How will you interpret this test? Option A, test vials can be used if sediment settles more slowly. Option B, test vials can be used if its sediment settles more faster. And option C, he has to check the vaccine vial monitor if they are good used. Option D, shake test is not applicable for IPV vaccine.
C.
Option D is the right one. Shake test is not applicable for IPV vaccine. Fourth MCQ is there is extremely load shedding in some cold chain center where OPV vaccine is stored in ILR for many days and there is complete electricity cut off for 3 days. The inner square colors of the vaccine vial monitor of the OPV vaccine has been become the same as that of outer circle. Now, how has these vials should be handled? Option A, discard them. Option B, discard them if only the shake test fails. Option C, shift these vials to the other nearby island available. Consume them as early as possible.
A.
Alpha.
A.
Yes, option A is the right one. These should be immediately discarded. Fifth MCQ is in the EPA center, XYZ measles vaccine is administered on every Wednesday. The LHE appointed there opened one vial of the measles vaccine containing 10 doses at 7 a.m. Every time after vaccinating the child, she immediately puts back in the vial in the ILR. At closing time of 2 p.m., still 3 doses of vaccines are left in the vial, and vaccine vial monitor is intact too. Now, how has she had to handle this vial? Option A, discarded. Option B, can be kept in ILR monitoring, correct cold chain for 28 days. Option C, discard the vial once it gets empty. Option D, keep it till next day to vaccine one child left due to his non-availability on Wednesday.
A.
C.
Alpha is the right one. It should be discarded. In an immunization campaign, a WHO pre-qualified vaccine XYZ is administered to all the children below the age of 5 years. The vaccine vial contains 10 doses of vaccine, and vaccine vial monitor is attached on the cap of vial, which gets removed after opening the vial. How this vaccine is handled provided that efficacy remains intact. Option A, all open vials can be used till the completion of 5 days immunization campaign. Option B, all open vials can be used for 28 days. Option C is all open vials should be discarded after 6 hours. And option D, it should be kept for next upcoming campaign.
C.
C. C.
Yes, option C is the right one. Seventh MCQ is a vaccine vial monitor is a thermochromic label put on vial containing vaccine. A vaccine vial containing 10 doses can be used for 28 days once opened if. Option A, only if it is in liquid form and its opening is submerged in cold water. Option B, expiry date left in 3 weeks and aseptic techniques are used to withdraw doses. Option C, contains adequate mercury-based preservative and vaccine vial monitoring is intact. It is, and option D, it is WHO pre-qualified and opening time and date is not mentioned on it.
C.
Yes, option D is the right one. Eighth MCQ is a father takes his 3 childs to hospital for WHO pre-qualified influenza vaccination. The hospital has those vials that contains one adult dose. However, the hospital staff did not refuse him and vaccinated all the 3 children by administering one half of the vaccine. However, the leftover vaccine should be handled. Option A, should be immediately discarded after opening. B, can be kept for 28 days provided that the appropriate cold chain is maintained. Option C, discarded after 6 hours if not consumed. And option D, can be consumed for as long as vaccine vial monitor remains good.
A.
A.
No, C is the right one. It should be discarded after 6 hours. Ninth MCQ is all freeze-dried vaccines become much more heat sensitive after they are reconstituted. Which among the following is the most heat sensitive vaccination? Option A है B vaccine, option B measles vaccine, option C rubella vaccine, option D polio vaccine, and option E is DPT vaccine.
A.
B.
Option D is the right one. Polio vaccine. Hep B is the most heat stable vaccine. 10th MCQ is all vaccines with the exception of those approved for use in controlled temperature range should be stored according to WHO or manufacturer recommended temperature. Normally between which range? Option A +2 to +6 degrees, option B +2 to +8 degrees, option C -2 to +2 degrees, option D +2 to -8 degrees, and option E is 0 to 8 degrees.
B.
B.
Option B is the right one, +2 to +8 degrees. This is a YouTube link of our channel. These are references and thank you.